Postural orthostatic tachycardia syndrome, or POTS, is a condition that affects the nervous system. It impacts how the body regulates blood flow, especially when moving from lying down or sitting to standing up. In simpler terms, imagine your body struggling to adjust when you stand up quickly. Your heart might race, you might feel dizzy, and you might even faint. This happens because, with POTS, blood pools in the lower body upon standing, leading to insufficient blood flow to the brain. POTS is more common in women than men, and often starts in the teenage years or young adulthood. POTS can manifest with a variety of symptoms, some more common than others. A hallmark symptom is lightheadedness or dizziness upon standing, often accompanied by a rapid increase in heart rate. Other frequent symptoms include fatigue, brain fog, and headaches. Some individuals may experience shortness of breath, chest pain, or even fainting episodes. It's important to note that POTS symptoms can vary widely from person to person. Some may experience mild symptoms occasionally, while others face severe and debilitating symptoms daily. The unpredictable nature of POTS can make it particularly challenging to diagnose and manage effectively. While the exact causes of POTS remain elusive, researchers believe that various factors may contribute to its development. This condition, which stands for Postural orthostatic tachycardia syndrome, is characterized by an abnormal increase in heart rate that occurs after sitting up or standing. The complexity of POTS makes it a challenging condition to study, but scientists are making strides in understanding its underlying mechanisms. One theory suggests that POTS may result from an autoimmune response triggered by a viral infection. This means that after the body fights off a virus, the immune system might mistakenly target its own tissues, leading to the symptoms associated with POTS. This autoimmune hypothesis is supported by the fact that many patients report the onset of POTS following a viral illness. In such cases, the body's immune system mistakenly attacks healthy cells, disrupting the nervous system's ability to regulate blood flow effectively. This disruption can cause a range of symptoms, including dizziness, fatigue, and palpitations, which are hallmarks of POTS. The nervous system's role in maintaining blood pressure and heart rate is crucial, and any interference can lead to significant health issues. Genetics may also play a role, as POTS appears to run in families. Researchers are investigating specific genetic markers that might predispose individuals to develop this condition. Understanding the genetic component could lead to more targeted treatments, and potentially even preventive measures for those at risk. Furthermore, certain medical conditions, like diabetes and Ehlers-Danlos syndrome, have been linked to an increased risk of developing POTS. These conditions can affect the body's connective tissues and blood vessels, potentially contributing to the dysregulation seen in POTS patients. Managing these underlying conditions is crucial for improving the quality of life for those affected. More research is needed to fully understand the complex interplay of factors that lead to POTS. Scientists are continually exploring new avenues, from studying the immune system's role to examining genetic predispositions and the impact of other medical conditions. As our knowledge expands, so too does the hope for better diagnostic tools and more effective treatments for those living with POTS. Section 4. Diagnosing POTS, tests and procedures. Diagnosing POTS can be challenging as its symptoms often overlap with other conditions. Patients may experience dizziness, fatigue, and rapid heart rate, which are common in many other disorders. A thorough medical history and physical examination are crucial first steps. The doctor will ask detailed questions about the patient's symptoms, their onset, and any factors that may exacerbate or alleviate them. This helps in understanding the pattern and severity of the symptoms. A key diagnostic tool is the tilt table test, which measures heart rate and blood pressure while the patient is tilted at different angles. This test is particularly useful in identifying orthostatic intolerance, a hallmark of POTS. During this test, doctors monitor how the body reacts to changes in posture and blood flow. The patient is secured on a table that tilts from a horizontal to a vertical position, and the body's cardiovascular response is closely observed. Other tests, such as blood tests and electrocardiograms or EKGs, may be performed to rule out other potential causes of the symptoms. Blood tests can check for anemia, infections, or hormonal imbalances, while EKGs assess the electrical activity of the heart. Diagnosis often involves a combination of clinical evaluation and specialized testing to confirm the presence of POTS. The results from these tests are analyzed together to provide a comprehensive understanding of the patient's condition, ensuring an accurate diagnosis and appropriate treatment plan. Section 5. Treatment options and lifestyle changes. Currently, there is no one-size-fits-all cure for POTS. However, various treatment options and lifestyle modifications can help manage symptoms and improve quality of life. Medications, such as beta blockers and fludrocortisone, can be prescribed to regulate heart rate and blood pressure. Increasing fluid and salt intake can help increase blood volume, thus improving blood flow to the brain. Compression stockings can prevent blood from pooling in the legs, reducing dizziness upon standing. Lifestyle changes such as regular exercise, a balanced diet, and adequate sleep are crucial for managing POTS. Section 6. Managing POTS daily. Living with POTS often involves making adjustments to daily routines to minimize symptoms. Start the day slowly, allowing ample time to wake up and gradually increase blood flow before standing. Stay hydrated throughout the day by drinking plenty of water or electrolyte-rich beverages. Avoid prolonged standing and incorporate regular movement into your day. If you experience dizziness or lightheadedness, immediately lie down or sit with your head lowered between your knees to improve blood flow to the brain. Listen to your body and learn to recognize your triggers, adjusting your activities and routines accordingly. Section 7. Living with POTS. Key takeaways. POTS, or Postural Orthostatic Tachycardia syndrome, is a complex condition that affects the nervous system's ability to regulate blood flow. This can lead to a variety of symptoms that can significantly impact daily life. Its symptoms, often triggered by changes in posture, can be diverse and unpredictable. Common symptoms include dizziness, lightheadedness, fainting, rapid heartbeat, and fatigue. These symptoms can vary greatly from person to person and can change in severity over time. While the exact causes of POTS remain unclear, research suggests that a combination of factors, including autoimmune responses, genetics, and underlying medical conditions, may contribute to its development. Studies are ongoing to better understand these contributing factors and to develop more effective treatments. Diagnosing POTS involves a combination of medical history, physical examination, and specialized tests, including the tilt table test. This test helps to measure how the body responds to changes in position and can be crucial in confirming a POTS diagnosis. Treatment approaches focus on managing symptoms and improving quality of life through medications, lifestyle modifications, and adaptive strategies. Medications may include beta blockers, fludrocortisone, and midodrine, among others. Lifestyle changes such as increasing fluid and salt intake, wearing compression garments, and engaging in regular, gentle exercise can also be beneficial. Living with POTS requires ongoing self-care, open communication with healthcare providers, and a proactive approach to managing symptoms. Keeping a health journal to track symptoms, practicing relaxation techniques, and participating in support groups can provide valuable support and help individuals manage their condition more effectively. By staying informed and working closely with their healthcare team, those living with POTS can find ways to improve their quality of life and navigate the challenges of this condition.